It's called Prolotherapy, a broad term for a group of non-surgical techniques that can stimulate healing inside the body. One such treatment involves using a patient's own blood or platelet-rich plasma to promote and accelerate healing, potentially allowing the body to repair its own damaged tendons, cartilage, or joint structures.
In our clinic, we use injection techniques to help heal and repair tissues that sometimes have an arrest in healing.
Dr. Ben Rawson treats people like Jordan Spinato, who suffered a painful hip injury after playing collegiate volleyball.
I couldn't stand. I couldn't get food for myself in like the college cafeteria. I was in a wheelchair for that. It just got worse and worse.
Dr. Rawson joins Charm founder Dr. David Harris and his team of physicians and therapists treating patients at Charm, or the Center for Healing and Regenerative Medicine in Austin, Texas. A pioneer in the field, Dr. Harris and his team use one or a combination of non-surgical injection techniques to stimulate the body's own ability to heal itself.
There are some situations where surgery simply does not make sense, or where it's attempted, where if the patient were better informed about the concept of regenerative medicine, they would almost certainly not choose to do surgery for those conditions.
When a patient is injured, bleeding from microscopic tissue tears release platelets into the bloodstream. These platelets release healing proteins called growth factors, which can accelerate tissue and wound healing. PRP, or platelet-rich plasma therapy, reproduces this natural process by injecting damaged tissue with the patient's own concentrated blood. The blood is drawn and placed in a centrifuge in order to separate the different types of cells and to obtain a fluid rich in platelets and growth factors.
We developed an in-house process over a series of years that perfected our ability to get the highest quality platelet counts with less of the things that you don't want to have in your platelet-rich plasma.
Those growth factors do a multitude of things. They help regrow new blood vessels to bring nutrients to the tissues. They help stimulate macrophages to come in that kind of eat up dead tissue, as well as calling in stem cells that really are the building blocks of tissue repair.
Most often, the treatment is combined with highly specialized physical therapy, working together to stabilize the areas around the injury in hopes of producing a pain-free and renewed outcome for patients.
I was pleasantly surprised that the Prolo and the PT areas mingle and they work hand in hand, knowing what each person is doing and with each client, with each patient. It's remarkable. That's what it's supposed to be.
It's pretty undeniable when somebody goes from having severe pain to having no pain and being able to run and exercise again. We can cure so many conditions that most people don't even know they can have a resolution to.
Now, of course, there are some situations where surgery is indeed necessary to repair an injury. Regenerative medicine offers an alternative, non-surgical solution to patients who've had surgery and remain in pain, or whose injury may call for less invasive treatment. Speak to your doctor about all of the possible treatment options.